If you've ever thought,
I'd definitely know if I had an STI.
this video is for you. There's some STIs that aren't obvious when they infect you, and chlamydia is one of the quietest infections out there, and it's been moving very silently. Now, chlamydia is a sexually transmitted infection, and it's caused by a bacteria called Chlamydia trachomatis. It's one of the most common STIs in the world, and yet it's often misunderstood and not taken seriously enough. One of the main reasons chlamydia is so important to talk about is because most women who have it don't have any symptoms at all. But chlamydia is completely curable with antibiotics when it's detected early and treated early. Now, the biggest problem is when chlamydia is left untreated in women. It can lead to serious long term health issues like pelvic inflammatory disease, infertility, and ectopic pregnancy, which is a pregnancy that happens outside the uterus and it can be life threatening. Chlamydia also increases the risk of getting HIV and other sexually transmitted infections. It's also very possible to have chlamydia at the same time as another STI, for example, chlamydia and gonorrhea. Chlamydia is extremely common worldwide. In 2020 alone, about 128 million new cases were reported among people aged 15 to 49. But because so many people don't have symptoms, experts believe the real number of infections is much higher, possibly even double that. Many people are living with chlamydia and have no idea that they're infected. Chlamydia is spread through sexual contact, and this includes vaginal sex, anal sex, and also oral sex. Penetration is not necessary for transmission. Any sexual contact that involves exposure to infected fluids can spread the infection. When chlamydia infects the vagina, some women may notice symptoms, and these include a change in your vaginal discharge, and it's noticed as an increased fluid that can be yellow or pus like, bleeding between periods, and bleeding after sex. However, many women with vaginal chlamydia still don't notice anything unusual. Chlamydia can also infect the vulva, which is the outer parts of your genitals. Everything that's outside huko chini, that's the vulva. When it's infected, it can become red, swollen, and you can also experience increased urination and burning sensation while urinating. You might actually think that you have a UTI, but the cause of your symptoms is chlamydia. Chlamydia can also be transmitted during oral sex and it can infect the throat. Now, throat infections caused by chlamydia usually don't have symptoms, which means people often don't know that they're infected, but they can still pass the infection to someone else. One of the biggest concerns of chlamydia in women is the risk of complications. In about two-thirds of people, genital chlamydia infections may clear on its own within a few weeks. Lakini in some women, the infection can stay in the body without causing any symptoms. And during this time, the bacteria can spread from the vagina through the cervix and into the uterus and then up into the fallopian tubes. Now, when the fallopian tubes become infected, they can become scarred. And this scarring can block or damage the tubes, making it harder to get pregnant and increasing the risk of ectopic pregnancy. The infection can also spread to the ovaries and other structures in that area. And this condition is called pelvic inflammatory disease. Pelvic inflammatory disease can cause chronic pelvic pain, infertility, and in some cases, it can be life threatening. This is why early testing and treatment is very important. Testing for chlamydia is very simple, by the way. A healthcare provider may take a sample of the vaginal discharge and then send it to the lab for testing. And when testing for chlamydia, it's also recommended to test for other STIs such as gonorrhea and HIV. Now, if you test positive for chlamydia, it's also very important that your sexual partner or partners are also tested and treated, even if they feel fine. Treating only one person while the partner remains untreated can lead to reinfection. It's basically like you're playing ping pong, passing it to one from one person to the other. Yeah, that's what you're doing. Because so many women with chlamydia don't have symptoms, regular screening is very important. Screening is recommended at least once a year for sexually active women, especially if you've had an STI before. If you have a new partner, if you have more than one sexual partner, if you don't use condoms consistently, if you have a partner who has other sexual partners, or if you engage in sex work. Chlamydia is treated with antibiotics, and when taken correctly, antibiotics can completely cure the infection. All sexual partners from the past 60 days should be treated at the same time. So during treatment, it's important to avoid sex until at least 1 week after finishing your antibiotics, and this helps prevent reinfection and further spread to other people. There's currently no vaccine to prevent chlamydia, but there are effective ways to reduce your risk of infection, and this includes using condoms consistently during sex, whether it's vaginal, anal, or oral, reducing the number of sexual partners that you have, and getting tested and treated early if there's a risk of exposure. So, if you've had unprotected sex, please go and test for chlamydia. If someone is diagnosed with an STI, informing your sexual partners is very important so that they can also get care. Chlamydia is common, it's treatable, and it is preventable. What makes it dangerous is how easily it can go unnoticed. Regular testing, honest conversations, and access to care are key to protecting sexual and reproductive health. Knowing your status is not something to be ashamed of, it's an act of self care and empowerment. I am Dr. Nasra Fundikira, and if this video was beneficial to you, if you learned something new, please like, comment, share, and stay tuned for more.